Splinting is a technique used in athletics to immobilize and support a body part that has been injured, like a broken bone or a sprained joint. Athletic trainers use splinting techniques to provide immediate support and protection to the affected area until the athlete can be examined and treated by a physician. Splinting plays a major role in the management of musculoskeletal injuries that occur during sports, both in practice and competition. It is also used to treat overuse and soft tissue injuries like tendinitis and sprains, and for acute traumatic injuries like extremity fractures and joint dislocations. Compared with casts, splints permit tissue swelling and may prevent neurovascular damage. Apply a splint as soon as possible after the injury for maximum benefit, and pay close attention to the proper splinting technique. When used quickly and effectively, splinting can increase patient comfort due to overuse or injuries, decrease the likelihood of further damage following an acute injury, and facilitate recovery. Splints are only effective when they are properly placed. Follow these steps. Immobilize the affected limb into a neutral position. Examine and prepare the affected limb. Check for open wounds, and if present, cover any open wounds first with sterile dressing. Select the appropriate splint. Choose a rigid, soft, or pneumatic splint. The type of splint is determined by the type of injury and the availability of on-site materials. Apply the splint to the affected limb. The splint should extend beyond the injured area to immobilize and support the limb. To test for efficacy, make sure that the splint is snug but not too tight. A tight splint will restrict circulation and can be counterproductive. Place padding between the splint and the affected area to prevent pressure on joints and bony projections. Secure the splint with bandages, adhesive tape, or other materials. The materials used to secure the splint should be tight enough to hold the splint securely, but not tight enough to cut off circulation or place unnecessary pressure on joints, bony projections, or skin. Ask for feedback. Does the athlete report numbness, tingling, or swelling that would indicate poor blood circulation? If yes, adjust the splint if necessary.